How has hair loss from reproductive cancer treatment been seen historically? Hair loss from reproductive cancer treatments has been a well-known and often distressing side effect for many years. Doctors have long observed that chemotherapy, which is commonly used to treat cancers like testicular, cervical, and ovarian cancers, frequently causes hair loss. This condition, called alopecia, happens because chemotherapy drugs target rapidly dividing cells, including hair follicle cells during their growth phase. As a result, hair often begins to fall out within 1 to 3 weeks after starting treatment. The severity of hair loss has varied depending on the specific drugs used, the doses, and the treatment schedule. For example, high-dose chemotherapy regimens given every 3 weeks tend to cause more extensive hair loss. In contrast, lower-dose or weekly treatments sometimes lead to less severe hair loss because the hair follicles have more time to recover between treatments. Historically, treatments like taxane and platinum-based chemotherapy, which are standard for ovarian cancer, have been associated with significant hair loss. Studies have shown that changing the schedule of drug administration, such as switching from every 3-week to weekly doses, can help reduce the severity of hair loss. In breast cancer, which is often treated with chemotherapy followed by hormonal therapy, a different pattern of hair loss has been seen. Besides the initial loss caused by chemotherapy, some women develop pattern baldness similar to male or female pattern hair loss. This is due to hormonal changes caused by drugs like aromatase inhibitors or selective estrogen receptor modulators. Although this type of hair loss was less recognized in the past, it has gained more attention recently as doctors understand the hormonal effects of these treatments. Some patients experience persistent hair loss long after finishing chemotherapy. This ongoing hair thinning, called persistent chemotherapy-induced alopecia, has been documented in survivors of reproductive cancers. Usually, hair regrows within months after stopping treatment, but in some cases, the hair loss can be long-lasting or even permanent. This is often due to follicle miniaturization, which resembles pattern baldness seen in aging. The emotional and social effects of hair loss have been significant throughout history. Many patients report that losing their hair impacts their sense of identity, privacy, and confidence. Because of this, supportive measures have been developed over time. These include scalp cooling devices that can help reduce follicle damage during chemotherapy, wigs and head coverings to help patients feel more comfortable, and topical or systemic treatments to encourage hair regrowth. Overall, hair loss from reproductive cancer treatments has been recognized as a major side effect that affects quality of life. Advances in understanding how hair loss occurs, along with improvements in treatment protocols and supportive care, continue to help patients manage this challenge better. It remains an important aspect of cancer care, emphasizing the need for personalized approaches and emotional support during and after treatment.